my menstrual cycles. They had become very heavy, so much so that I couldn't even leave my house for a day or two. Very long, 8 days, very crampy, just almost unbearable.
I had 7 to 9 day periods every month, and they were very heavy for at least 4 days of that. Swelling, bloating, cramping, very heavy bleeding.
Many women suffer from issues with their menstrual cycles. Heavy flow, painful flow, it can totally disrupt and or ruin their life. Well, we have the ability to improve that problem.
Endometrial ablation is the perfect choice for women who want to minimize or possibly even stop bleeding during their menstrual cycle.
The candidate for an endometrial ablation is any woman who's done childbearing, so doesn't wish to have any further children, and who's suffering from heavy or prolonged periods. And the procedure works very well to minimize the amount of bleeding each month and ideally stop bleeding completely.
I've been on the pill before, and I didn't like some of the side effects that the pill had on me personally. I'm very active, and just the thought of being able to minimize the impact that my periods have on my active life, and I thought my husband would be pretty supportive as well for me to be a normal person longer during the month.
I really wasn't interested in a hysterectomy. Wasn't interested in going back on the pill. I'd had my tubes tied. Didn't want to do an IUD, and so the ablation just seemed like an awesome choice.
So how does it work?
The uterus is similar to an inflated balloon. The area that produces menstrual flow is the entire area of that cavity. With these procedures, we're able to remove just that inside lining by cauterizing it by a number of methods. If you cauterize the lining of the uterus, it still receives the hormonal signals to have flow, but since that lining is no longer there, no flow occurs. So 90% of our patients never have a menstrual cycle again. And because there's no cuts, no incisions, they're able to resume normal activities within a day or two.
It's so simple to perform and can be done in the office setting, which is real nice. And it's done with an anesthesiologist, so there's good sedation. The patient's very comfortable during the procedure, and the recovery is very quick as well.
The next day I woke up and I ran 5 miles first thing the next morning, and I would do it again in a heartbeat.
I haven't had a cycle, no PMS, no nothing. It's just awesome.